Hey everybody, my name is Dr. Tyler Guyman. I am a physical therapist here at our Buckeye location for AZOPT. And I wanted to take a few minutes here to kind of share a little breathing technique with you guys. As we know, there's a lot of stuff going around about the coronavirus and the COVID-19. And one thing that we have learned for sure is that it is a respiratory virus that will affect your lungs and sometimes make it difficult for breathing and getting a good deep breath. So one thing I wanted to go over with you guys today was a technique we call the active cycle of breathing. And this is a technique, especially if you start to develop any sort of fluid or mucus in your lungs. This is a technique to help kind of clear it out, get you a little bit better breath. And so really there's three parts to this. As we go through this, I have a little handout here I can show you. We'll make sure this gets posted as well. So the first part of this is what we call like your resting breaths or your breathing control. So when you do this, you just want to have a nice comfortable position, either standing or sitting. It works fine. Try to keep everything nice and relaxed. And usually it works a little bit better if you just kind of take some good gentle breaths in and out through your nose. This will help kind of calm things down. Try to relax the shoulders a little bit, relax the chest. This is just going to help kind of get your body relaxed and get you ready for the other parts of this. The second part is really we want to try to expand the chest. We want to try to get a good deep breath, get some of that air in behind the mucus or the fluid that kind of develops down in the lower part of the lungs to help prepare it to be ready for kind of clearing out of our lungs. So with that, what you're gonna wanna do is you're gonna wanna take a little bit deeper breath. Sometimes you can even hold your hands here on your ribs. Feel that chest expansion there a little bit. What you can do to try to get a little bit more success with that is hold it for maybe about 3 seconds. So you'll breathe in, hold for that 3 seconds, then exhale. So you want a gentle to exhale gently. You don't want to force it out. You just want a good deep breath, get that air to get behind the mucus, try to clear it out in preparation for kind of the clearing process. The last one is what we call huffing or huff coughing. So this is going to be similar to starting with the chest expansion. You're going to take a breath in, and then you're going to huff or huff cough. It's almost like when you have your glasses and you're trying to clean them, or you're trying to create some sort of a foggy effect on a mirror. So it'll be so like that. So you're probably gonna just do a couple cycles of these, maybe 3 of the huff coughs. And that's hopefully the goal with that is if you do have some fluid or some kind of gunk or phlegm in your throat, your lungs, that will almost cause you to start to cough after that, kind of clear it out of there, because that's what we really want to get out of there. So those are the 3 different types of the breathing techniques. You have your resting breathing, just really calmed and relaxed, breathing in and out of your nose. If you're unable to breathe in and out of your nose, you can try to breathe in through your nose and out through your mouth, but with what we call a pursed lip breathing. So it's almost like you're trying to kind of blow out a candle. The other one is that chest expansion, really trying to open up those ribs and those lungs to get a good deep breath in there, be able to kind of start to clear some of that mucus out. And then the last one would be that huff coughing. So I do have a little diagram here. Like I said, we'll make sure this gets posted as well. But you would start kind of at the top there with your breathing, your relaxation. You would do, let's see here. Yeah, your breathing control. You take your 3 to 4 kind of your deep breaths, go back to your breathing control, 3 to 4 deep breaths. Breathing control again, and then you go into that huffing and that try to get that cough, that phlegm out of there. If at any point you start to get a little lightheaded, get a little dizzy, whether it's because you're holding your breath a little bit too long or you're getting a little bit too much air in there, just resort back to kind of the resting breathing. I would recommend if you're having issues respiratory wise or breathing, you could do this 3 times a day, morning, afternoon, evening. Really, we're just trying to promote good pulmonary health. Like I said, this is really a respiratory virus that's going around. It really latches onto some of those tissues in our lungs. And you kind of start to build up this fluid or this phlegm as it affects those tissues. So if you have any questions with this, please reach out to us. I know we're all trying to do our part to stay safe during this this virus, and you know, where our goal is to try to keep everyone as healthy as we can, so that we can keep moving, keep staying active. And thank you for allowing me to take some time with you guys. Like I said, if you have a question, reach out to us, reach out to your therapist, and just try to stay active. All right, thanks guys.